So over the past several months, there's been much debate, of course, about how countries should distribute their limited COVID vaccines. However, despite all of this debate, many have suggested that all this focus on prioritization and indeed all the attention that has been paid to equity and ensuring vaccines are going into the right arms is responsible for slowing down the pace of vaccine administration. And so we should either significantly curtail the extent to which we're prioritizing or thinking about equity, or in fact, eliminating that focus entirely, which has led to this question that I'm going to address in the next 20 minutes or so, which is whether equity should be sacrificed in the name of speed in the rollout of COVID-19 vaccines. And so before I get started, I wanted to note that while I'm a member of several advisory bodies that addresses this particular issue and others with respect to COVID vaccines, the remarks I'll be making are my own and don't represent the views of these advisory groups or their members. But with that said, my involvement in these groups has helped to really shape my thinking about this topic, given the sorts of concerns and pressures I've experienced regarding vaccine distribution. So not only philosophical and ethical concerns, but very much been attuned to the political and public dimensions of these conversations. I should also note that my talk will focus on this tension between equity and speed at the domestic vaccine distribution context, not necessarily the international or global distribution of vaccines, though some of the insights that I might provide here might be applicable to that context. Okay, so one of the biggest tensions that's emerged in the domestic context of vaccine distribution has been between vaccine distribution schemes that are fair on the one hand and vaccine distribution schemes that are fast on the other, and whether these aims are ultimately reconcilable. This is manifested in many different ways. In California, the state initially produced a complex plan that identified numerous priority groups based on who had experienced the greatest burden from the pandemic. And after a slower than hoped for start to the rollout, something that it's a criticism that probably every jurisdiction, perhaps save for Israel, has heard in their vaccine rollout, the state abandoned several aspects of its plan in favor of a simpler approach that intended to really streamline and accelerate the rollout. In my province in Ontario, we didn't abandon any part of our plan. This is a plan that was developed in early December before we received any vaccines, but rather the plan was provided to hospitals and public health units and other clinics that would be distributing vaccines, alongside the guidance that while this is our plan, speed ultimately trumps precision, or speed trumps perfection. Basically a bit of a blank check to those that are distributing vaccines, suggesting that they might be able to deviate from the plan if that means getting vaccines into arms quicker. The plan in Ontario, much like the plans in many other jurisdictions, prioritized older adults who lived in long-term care facilities, healthcare workers, older adults living in the community, people of any age that had underlying health conditions that put them at severe risk for severe outcomes of COVID-19, individuals living and working in congregate settings, and other groups. In developing and communicating the plan, the most common bit of pushback that I received every time we were engaging different stakeholders about this is that we should really try to make it simpler and in fact just distribute vaccines on the basis of age alone. Start with those that are above the age of 80 and then descend in 5-year increments until you've vaccinated the entire population. Don't think about any other groups, whether it's essential workers or younger folks that might have underlying health conditions. There was an impression amongst those that I spoke to that this is in fact what other countries had done or were doing, despite the fact that, to my knowledge, no other country has allocated vaccines strictly on the basis of age. The United Kingdom is often heralded as doing the sensible thing and allocating vaccines just using age, but the UK, of course, has prioritized frontline health and social care workers alongside those who are 80 years of age and older. And it's also prioritized the clinically extremely vulnerable who are age 16 and older at the same time that they were vaccinating those 70 and above. So it wasn't strictly based on age. And Israel, too, is often reported as simply using age to prioritize, and that this has been the key to their success, despite the abundance of vaccine that they received in early days. Yet, like most other jurisdictions, Israel prioritized other groups on grounds other than age, like healthcare workers, populations with underlying health conditions, and essential workers. And so why did this perceived tension between speed and equity exist? And what was the reason for the push for rollouts to focus more on speed than equity? So here's my best characterization of the reason for this. So COVID vaccines are highly effective at preventing severe disease, hospitalization, and death. And so some may believe that any delays in getting vaccine into arms are likely to result in unnecessary morbidity or mortality, which is unacceptable. Many also felt that as more people get vaccinated, benefits are conferred to everyone. And so the faster everyone gets vaccinated, the safer everyone will be. And it was felt by many that the pursuit of equity in a vaccination program, or really these complex schemes of prioritization, slows down vaccine rollout because it tends to focus on populations that might take longer to be vaccinated, or it tends to require overly complex prioritization schemes and precision in implementation. So I note here that equity can, of course, take many forms, and it's important to understand really what we're talking about when we're talking about a tension between speed and equity. But I think largely equity is understood in these plans as allocating vaccines with priority to populations who are at greater risk of infection, transmission, severe disease, hospitalization, or death, and especially those that are experiencing these risks due to inequities in the social determinants of health. But really, when we're talking about this tension, equity is really being seen as any attempt at prioritization, particularly complex forms of prioritization, or precision in the allocation of vaccines. So, of course, any attempt at prioritization doesn't equate to equity, so this is a bit of jumbling these concepts together, but really the idea is that equity, prioritization, precision, these are all ideas that are in a way antithetical to speed. And so given these premises, many concluded that speed should be privileged over equity, prioritization, or precision in the rollout of COVID vaccines. So I'll return to this argument in a moment, but first I thought I'd share and address what I view as actually being a pretty important political reason as to why equity has been characterized as being the enemy of speed. So everyone will be familiar with vaccine tracker websites. There's literally dozens of them. Here's just a few examples from the Financial Times, from Our World in Data, from CNN, and from the New York Times. Here's what these trackers look like, and here's what they almost always track. The total number of vaccine doses administered by a country, the total number of doses administered per 100 people, the total number of doses administered per day, and the share of delivered doses that have been administered. You'll notice that every metric of success is, in fact, a measure of speed. That is how fast vaccines are being administered. Being on my province's vaccine distribution task force, I can tell you that every day the media and public is scrutinizing these figures in order to rate how well our province was doing when it comes to vaccine administration. And this is something that you'll all have experienced surely in your respective jurisdictions as well. In particular, the media and the public focused on this idea of vaccines in freezers, or the supposed gap between the number of vaccines that had arrived within a jurisdiction's borders and the number of vaccines that had made it into people's arms. It's my view that it's actually that it's been the most significant pressure for governments to do whatever it takes to compare more favorably with other countries where pace of administration is the only metric of comparison. So if that's the only metric that we're comparing, then of course that's going to be what governments tend to want to prioritize. So consequently, irrespective of the normative question of whether equity ought to be sacrificed in the name of speed, I'd posit that speed will continue to trump equity as the driving force of vaccine rollouts until such a time as success is also understood in terms of equity, or at least in the achievement of actual public health goals, which is something that I'll return to in a bit. So this is a bit of my descriptive hypothesis as to why this tension has received so much attention and why equity has been eschewed in many cases in favor of speed. But let's return to the more interesting, perhaps normative question I've set out as to whether equity should be sacrificed in the name of speed in the rollout of COVID vaccines. So as I see it, there are three main ethical reasons that might be supplied as to why we might sacrifice equity for speed. The first is if we don't think equity is of moral importance. So of course, if we don't think equity is a desirable ethical goal, then we'll probably be okay with it being traded off with speed. The second is if we think the pursuit of equity constrains or otherwise precludes the achievement of one or more important values or ends to a degree that we consider unjustifiable. And finally, one might think we should sacrifice equity for speed if speed pursued with no or less attention to equity would actually end up conferring greater or faster benefits to equity-seeking groups anyway. So these likely aren't all the reasons that might be supplied or offered for why we might want to sacrifice equity in the name of speed, but they're certainly the ones that have been presented to me most often and perhaps seem the most plausible. So in the remainder of the presentation, I'll try to show why each of these reasons isn't persuasive or has not in fact occurred to warrant a sacrifice of equity. And I'll start with the idea that we should sacrifice equity for speed because equity isn't of moral importance. Now, for this one, I'm not going to spend much time arguing why equity isn't morally important. I think it's overdetermined why it's important, and really every vaccination distribution plan that I've seen has articulated some commitment to equity. So I won't really spend much time responding to the idea that equity isn't of moral importance. Yet it's worth noting that some may adopt the utilitarian perspective, of course, that we should distribute vaccines in whatever way will tend to produce the greatest good for the greatest number. And so here equity could conceivably be sacrificed if doing so means we could produce more good with the vaccines. And to dispute that, of course, I'd need to dispute why utilitarianism is wrong. I'm not going to do that. It's just true that some people hold utilitarian views despite the criticisms that utilitarianism has received. And so we can expect that they might be fine trading off equity with speed if that ends up producing greater utility, however they might define that. So instead, what I thought I'd do is highlight an interesting trend I've observed, which is that utilitarian reasoning is perhaps considered to be more ethically justifiable, if not ethically required, in the context of public health emergencies. So just as a couple examples, consider these insights from Bob Veach and Ken Kirkwood. So Veach asked whether we should, in disaster relief, and here we might extend this to any public health emergency context, retreat to a utilitarian ethic where an ethic of justice or equity might normally prevail in ethical thinking around resource allocation. So let's put to the side the notion that utilitarianism and justice are necessarily mutually exclusive and consider that we might simply retreat or emphasize this utilitarian ethic in this context. Ken Kirkwood wonders whether this in fact does occur. He hypothesizes that there's an escalator clause when allocating scarce resources, that the greater the threat, so if we're facing a pandemic, the greater the moral force that utilitarianism has when making public health decisions. And so I was curious about whether we do in fact think in more utilitarian terms in public health emergency response. And so I ended up leading a study a few years ago where I interviewed policymakers and decision makers who are themselves involved in infectious disease outbreaks. And so just as a very brief example, one of the participants of my study told me that if focusing on the ideas of equity or fairness would be perceived to take away resources from managing the overall issue, whatever it would be, let's say an epidemic, then that's just not going to be on the agenda. So you can start to see where the tension between equity and speed might come from. If equity is even perceived as taking away from managing the pandemic, whatever that might mean, it's not going to be on the agenda, or at least it's not going to be seen as something that could be pursued by public health policymakers. So it's a bit of an empirical question, which my study has begun to provide insight into, as to whether we tend to accept utilitarian reasoning more in the context of responding to public health emergencies like pandemics. And this might explain some of the aversions we're seeing to equity in favor of speed in the vaccine rollout, or perhaps it's simply because we tend to accept utilitarian reasoning a bit more in this context. But I'd like to pick up on this idea raised in the quote that focusing on equity might be perceived as taking away from managing the overall issue. Do we have any reason to believe that this might actually be the case? And so this actually nicely corresponds with the second possible reason I've offered as to why equity might be sacrificed in the name of speed, which is when the pursuit of equity constrains or otherwise precludes the achievement of other important values or ends to a degree that we find unjustifiable. That is, when equity takes away from something we feel is of importance in the vaccine rollout. And so to fully explore this question, we need to know what values or objectives are actually seen as being in tension with equity. Clearly, speed is viewed as being in tension with equity, but surely speed itself isn't a goal. At best, it's a quality for how you pursue the achievement of some other goal. Another goal that we might take as self-evident because we're not actually naming it when we talk about equity versus speed, but we might think about this other aim as something like minimizing overall harm. If equity slows down the vaccine rollout, then this argument might suggest that overall harms might obtain, which is bad and should be avoided. And so what this really points to is that we need to critically examine and reflect upon the goals of a COVID vaccine program to evaluate the extent to which those goals align or misalign with the pursuit of equity. So here are the stated goals of my province's vaccine rollout, which despite all being goals of the rollout, they're listed in rank order. The first is to prevent deaths, the second is to prevent illness, hospitalization, and ICU admissions, and the third is to reduce transmission. You'll note, just to harken back to this slide, that none of these goals are included as the metrics of success for vaccine administration. It's strictly pace. And so clarifying vaccine program objectives, rather than simply talking about the speed at which the program unfolds, is important because deaths averted or hospitalizations averted and other metrics that are directly linked with vaccine program objectives are likely to militate in favor of deploying the harm-reducing powers of COVID vaccines to populations experiencing the greatest burdens of death, hospitalization, exposure, and transmission. And we know from the empirical literature that these groups are disproportionately represented by less advantaged populations, including Indigenous, Black, and racialized populations, low income and precariously employed workers, and those with poor baseline health resulting from social inequities. In short, the groups that would tend to be included in equity strategies. So for instance, in Ontario, we've argued forcefully that because patients at any age who are on dialysis are at similar risk of death as those aged 70 to 79, we should be vaccinating both of those groups at the same time. This is equitable, and it would also tend to avert more deaths than if you simply adopted a so-called speedier age-only approach that prioritized 70 to 79-year-olds and then worked your way down the age bands. And so this isn't to really ultimately deny that efforts and resources devoted to the pursuit of equity won't at some point have diminishing marginal returns or begin to threaten the ability to pursue other important values or ends, or even jeopardize the achievement of equity overall. But I think an open question exists as to whether any jurisdiction has actually reached the point or whether they're likely to reach such a point, particularly given the points I've just made about how the aims of equity and focusing on preventing risk in a vaccine program to achieve its overarching public health goals actually tend to run together. I think we should question whether the tension being pointed to between speed and equity might actually simply be a product of the fact that equity is, of course, more challenging to achieve. It might simply be more attractive to implement a vaccine rollout that doesn't have to grapple with the challenges of vaccinating populations who are harder to reach or whose needs are more difficult to address. And so finally, what about the argument that if we simply get vaccines in arms as quickly as possible, irrespective of whose arms they are, this would end up conferring greater or faster benefits to equity-seeking groups anyhow? So to answer this question, I'd like to draw on a case example of vaccine distribution in my province of Ontario. So for those less familiar, Ontario is the yellow province here in the middle of Canada. Geographically, it's the size of France and Spain combined, and is Canada's most populous province with 14.5 million people. Of its 14.5 million people, Ontario is home to roughly 265,000 Indigenous persons. And given that Indigenous persons in Ontario have experienced and continue to experience social injustice, tend to be negatively impacted by inequities in the social determinants of health, and experience worse healthcare infrastructure, the province decided that it would prioritize Indigenous persons at the very outset of our vaccine rollout. As you can see here, the vast majority of Ontario's 14.5 million people live in the southern part of the province. You can see Toronto is the big sort of red area in the middle there, and London to the west, and Ottawa to the east. Really, it's just most of the population is near the US border there. And while the majority of Indigenous persons also live in those urban settings, there are dozens of Indigenous communities in the northern parts of Ontario. And here's just a map of the First Nations communities in the north and northwest of Ontario. And so Ontario.
Maxwell, you've hit mute by mistake.
Oh, I apologize. I hope you didn't miss too much.
Not much.
So Ontario established what it called Operation Remote Immunity, an operation that brought vaccines to Ontario's remote Indigenous communities that don't have road access, communities that you can only fly into. Now, as mentioned, roughly 265,000 Indigenous persons live in Ontario, and most don't live in those remote communities. And despite the fact that Ontario has actually delivered more than 6 million vaccines to date, it actually hasn't completed vaccinating those 265,000 Indigenous persons. And really, this is because of the delivery, logistics, and operational challenges of doing so. But we haven't held back those 6 million doses until we focused on those populations. Rather, we started with those populations earlier on, knowing that it might take longer to fully vaccinate them. So this would appear to counter, I think, the view that if we simply get vaccines in arms as quickly as possible, irrespective of whose arms they are, this would end up conferring greater or faster benefits to equity-seeking groups. Ultimately, if COVID cases reach these isolated communities, if they have not reached high rates of community protection through vaccination, it's unlikely that herd immunity achieved in other regions of the province would sufficiently protect those populations. And so because adequate vaccination coverage amongst the least advantaged may take longer, I actually see this as a stronger argument to begin vaccinating these populations sooner via explicit prioritization or equity strategies. And finally, I think it's just worth noting that there's an expressive function of vaccinations. The act of prioritization signals to populations they're at risk and that it's important that they be vaccinated earlier than others. Not being prioritized, that is, if some groups are just lumped in with the general population at the end of the vaccine queue because they're not seen as much risk, might suggest to those populations that they aren't actually at risk, and so that there isn't actually an imperative to get vaccinated. And where populations know they're at risk, if they're not prioritized, that might signal to them some distrust or mistrust in the government, or a view that this is inequitable, which might actually jeopardize vaccine uptake. And so Alex, I'll just end with this conclusion slide, which tries to answer the question as to whether equity should be sacrificed in the name of speed. I'd say the answer is no, and I hope I've made a persuasive case why it shouldn't be. Speed and equity, I don't think are necessarily incompatible. Metrics of success, if only understood in terms of pace of vaccine administration, will tend to privilege speed over equity, but this really ignores the actual goals of COVID-19 vaccination programs. And equity, if pursued such that vaccines are allocated fairly to those at greatest risk, is actually more likely to rapidly realize the public health goals of a vaccination program. And because vaccine populations might actually just take longer, maintaining a focus on equity is also likely to result in getting the entire population vaccinated sooner. And I'll conclude by saying that the path of least resistance is often the enemy of equity, and so we should treat any claim that equity should be sacrificed in the name of speed with suspicion. So I'll stop there. Thanks very much for your attention.